On the one hand, this is diagnostic lang, no? Kung meron ka, no? Kung pinagdadaanan mo ngayon. On the other hand, when we talk about vaccines, particularly when we talk about Dengvaxia, one hurdle still for Dengvaxia is you need to know kung sinong nagkaroon na. Diba? Now, this does not test for that.
No.
What's the barrier there, and how do we get to a solution or a kit that can say na nagkaroon ka na and therefore you qualify for this regimen?
The technology actually exists. The only problem
In the
is
Philippines.
In the Philippines, the only problem is its sensitivity to actually pick up how far, how long was the exposure. So, for example, a serological test for dengue, let's say IgG, will tell you that you have been exposed from dengue in the past. If you have that positive, then you may have been exposed to the virus, then you may qualify for the impact of that. The only problem, though, is there are certain tests that may cross-react with other what we call flaviviruses, the cousins of the dengue, that may give you a false positive result.
Okay.
So that's why the technology before was developed to diagnose dengue, but not for this indication.
So what's the reliability now? What's the reliability?
We don't know. That's why the Department of Science and Technology is launching this research program to look into this, where I'm the one leading it. Actually.
Now, from a policy standpoint,
you are leading it.
Now, from a policy standpoint, until you get to a highly reliable test to stress for seropositivity with no false positives whatsoever, until that day comes, what would be the recommendation on Dengvaxia being part of the standard vaccination program?
Well, right now there are literature supporting the use of what you call indirect ELISA, which is actually a platform that is available in some of the centers, and I have that in my lab also. But it's for a national implementation that's going to be a challenge.
Okay.
The way I look at it is, if we are really set on reintroducing such intervention, and one of the prerequisites is a prior evidence of exposure, which means that the government has to set up testing centers distributed over to be able to select the individuals who will benefit more from the intervention.
Because people are, the clamor is understandable, but people are clamoring for i-roll out ang Dengvaxia. What you're saying is, actually, not only are we far from understanding the full effect of Dengvaxia, there's another step prior to that pati yan, hindi pa natin na-hurdle.
Yeah, we need to establish the science of it, because the technology that I was referring to was for a different indication for use, not for pre-testing for vaccine eligibility, which is a different indication. Although theoretically it may still support, but it still needs to be studied very, very well. And there are economic consequences of if it's on a programmatic approach, or if it's something to be accessible to the general public, and general public will decide whether to access the technology on their own pocket, or parents or family or cousins or whatever, lolos and lola, to access to the vaccine. It becomes now a decision of the public. And what that you call democratizing access to the vaccine. If the government cannot afford a national implementation program, maybe there is an option for people to actually choose to be vaccinated privately. And it's not the perfect system, but for as long as we provide them the right information when and when not, and access to technology on how and when it should be done, then maybe I believe our countrymen are smart enough to have their own conscious decision whether to access them or not.